Hey everyone, this is AJ. In this video, I am going to cover five important topics in the pediatrics. So let's begin. First one is Samantha. See, severe acute malnutrition. In order to diagnose the SAM, you have some criteria. That is, the age must be greater than 6 months. It means up to 6 to 5 years, 6 months to 5 years, 6 months to 5 years, and having the bilateral pedal. And the third one is the weight for height. It is weight height. The weight per height g square must be less than -3 square, 3 g square. And the MAC mid-arm circumference must be less than 11.5 centimeter. This is the criteria to diagnose as the SAM, severe acute malnutrition. First one is the age must be more than 6 months to 5 years. Bilateral, not unilateral, bilateral pedal. Weight for height, not height per weight. It is a weight for height. It must be less than -3 g square. MAC must be less than 11.5 centimeter. So how you are going to treat the SAM patient? So for this guys, you have to treat the patient by giving the IV fluids. It is a ringer lactate with the 5% dextrose solution. 5% dextrose solution is added to avoid the hypoglycemia. And you have to treat the other causes. Okay, by giving ORS, you are giving by correcting the electrical balances, everything. Done. So next, coming to the tumors, some important brain tumors. So what is the most common benign brain tumor of a children? It is a pilocytic astrocytoma. And what is the most malignant brain tumor of a children? It is a medulloblastoma. Question will says, which is the most common benign brain tumor in a children, which is located periphery to the cerebellum? Okay, see, these two tumors are originated from the cerebellum. Where? Cerebellum. These two tumors are originated from the cerebellum. So the question will ask, which of the following is the most common benign brain tumor of a children, which is located periphery of the cerebellum? Answer will be astrocytoma. Astrocytoma, it is periphery. Medulloblastoma central. See, middle center. See, sit central, middle. So most common malignant brain tumor of a children, which is centrally located in the cerebellum. That is the brain tumor. That is the medulloblastoma, or known as embryonal tumor. That is the embryonal tumor. Got it? Next one is the most common brain tumor, which is associated with the suprastellar calcification. That is the suprastellar calcification. That is the craniopharyngioma. Just remember these brain tumors, guys. And coming to this one, this is the method of feeding for the preterm and term. For the preterm and term children, you have to feed them according to this. So if it is the preterm, if the baby delivered before less than 28 weeks, then you have to give the IV fluid, or you have to give the total parenteral feeding. Less than 28 weeks, IV fluids, total parenteral. If it is born between 28 to 31 weeks or 29 to 31 weeks, then you have to give that as orogastric tube. That is feeding tube. Orogastric tube, feeding tube. If the baby born between 32 to 34 weeks, 32 to 34 weeks, you have to use the Katori spoon feeding. Katori spoon feeding or paladi. See, Katori spoon feeding like this. You have to feed with the Katori spoon feeding and paladi or paladi. So if the baby born more than 34 weeks, then you have to give direct breastfeeding. Are you okay? Or did you got it? Okay then. Next, coming to the main one is the short stature in children. Short stature in children. See, short stature is divided into two types: physiological, pathological. Physiological, pathological. Physiological in okay, short stature. Physiological, okay, now in physiological, growth velocity will be normal. In physiological, growth velocity will be normal. In pathological, growth velocity will be decrease. Okay, na? See, physiological is divided into two types: familial and constitutional. Familial and constitutional. What is familial? Familial short stature. It means parents' height must be less. Parents' height must be decreases, and the final height of the children will also be decreased. And here you can say that bone age is bone age equal to the chronological age. See, in the question they will just give in the history says that parents' height are also low, familial and the final height also less, or else they will say bone age is equal to chronological age. That is comes under the familial. See, family having the history of the shortness, it is called a familial short stature. Coming to the constitutional short stature, in this guys, the question will says there is a history of delayed puberty or growth. Constitutional short stature history will says there is a history of delayed puberty and growth. Okay, here the final height will be normal. And also says chronological age is greater than the bone age. Chronological age greater than the bone age. It is seen in the constitutional short stature. Got it? And coming to the pathological short stature, it is due to some underlying diseases. These are two types: disproportionate and proportionate. See, ratio of upper segment and lower segment must be 1.7:1. Upper segment, upper part, lower segment of the trunk, okay now, it must be having the value of 1.7:1. If this value, if the value is more than 1.7, then it is called as disproportionate. Disproportionate. Okay, so what are the causes of the disproportionate pathological short stature? In the exam, guys, they will give that the upper and lower segment value is 1.8. It means it is a disproportionate. If they says that the value is 1.5, it means proportionate. So if they give in the exam that given that value is 1.8, then it is a disproportionate. So you have to mark the answer from this table. Mnemonic is CARS. See, first one is congenital hypothyroid, achondroplasia, rickets, spondyloepiphyseal dysplasia. Mnemonic is CARS. Congenital hypothyroid, achondroplasia, rickets, spondyloepiphyseal dysplasia. And if the upper and lower segment, the value says it is less than 1.7, then it is a proportionate. So you have to mark the answer from this one. The mnemonic is feed. Food means it is due to malnutrition. E, endocrine growth hormone deficiency. E, extended diseases like CKD, celiac diseases. And also T for Turner syndrome, Down syndrome, and Noonan syndrome. So you have to mark the answer like this one. Coming to the last one, that is the pneumonia. Pneumonia, you have to classify the pneumonia as the green, yellow and the red color. See here, according to the IMNCI. Okay, now according to this one, international management of the something is there. Okay, now so okay. According to the IMNCI, pneumonia is divided into three groups. That is the three zones: green, yellow, red. See, green means cough without tachypnea, chest in drawing. So okay, and there is no cold, only cough. Then it is the diagnosis will be no pneumonia. No pneumonia. You can simply give the some home meds for the cough. It is, and coming to the yellow zone. See, yellow means having the cough with tachypnea, and also the child will having the chest in drawing. Cough with tachypnea and chest in drawing only. Then it is marked as pneumonia. See, no pneumonia. Here is no pneumonia. Here is mild to moderate. You can say just pneumonia. Okay, na? So okay. So for this one, you have to give the antibiotic, that is amoxicillin for the 5 days, and you have to review the patient after 2 days. Okay. Yellow category, cough with tachypnea or chest in drawing. The diagnosis will be the pneumonia. You have to give the patient the antibiotic, amoxicillin for the 5 days, and you have to review the patient after 2 days. Coming to the red zone. Red zone, it is with cough with stridor. See the cough with stridor, and there is a chest retraction. Chest retraction. There is also a danger sign. Presence of some danger signs. There is a more RR, and also in the more like severely dehydrated. Okay, now sunken eyes. The danger signs. Next, and also the patient will be unconscious and the severely dehydrated. Then you can see as mark as severe pneumonia. Severe pneumonia. This is no pneumonia, mild to moderate pneumonia. Is a severe pneumonia. Then you have to put in the red zone. So it means you have to give first of all you have to rehydrate the patient, and you have to give the injection of the ampicillin and also gentamicin anything, and you have to give the IV fluids, and you have to refer accordingly. So guys, these are the 5 topics I discussed. If you have any more doubts, you can just comment me. Thank you very much.